Welcome to the AME Food Testing Show. Today's topic, U.S. response to foodborne disease outbreaks. Our guest today is Jennifer M. Nuzzo. She is a senior associate at the UPMC Center for Health Security, an epidemiologist by training. Ms. Nuzzo's work focuses on international and domestic biosurveillance, situational awareness, and disease mitigation strategies. She also has worked on issues relating to water security, public health, and private partnerships in preparedness, mass critical care, and hospital preparedness. She is the associate editor of the peer-reviewed journal Biosecurity and Bioterrorism, Biodefense Strategy, Practice, and Science. She was a co-managing editor of Biosecurity Briefing, a weekly internet-based news, science, and policy update. She's published in the scientific literature on waterborne pathogens and has co-authored several manuals on environmental policy and planning. She has a Bachelor's of Science in Environmental Science from Rutgers, the State University of New Jersey. She also has a minor in Japanese language. She acquired a master's degree from Harvard University in the Public Health Department. She is now currently a student in a doctoral program of public health and epidemiology at Johns Hopkins University. Now, welcome with me, Jennifer Nuzzo. Jennifer?
Thanks so much, Andy. I really appreciate being on the show.
Well, can you add anything to your introduction for our 65,000 listeners who are primarily food production, food quality, food safety, and food security managers?
Well, I think you covered a lot of it, but I guess one of the key details that I left out is that I'm also an eater, so I'm really grateful for the work that all the food producers and your listenership do. Life would not be as fulfilling if they weren't around.
Well, Jennifer, I join you in that concern that every bite I take hopefully has one of our listeners that has supervised the food safety precautions in the preparation and distribution of that food. Let's start off with a very general question. What is the University of Pittsburgh Medical Center for Health Security?
Well, we're an interdisciplinary policy think tank. We do policy analysis. And we're actually based in Baltimore, Maryland, despite our affiliation with UPMC, which confuses everybody. But, we work a lot of times with, the federal agencies and lawmakers here in Washington. So it's one of the reasons why we're in Baltimore, despite the UPMC part of our name.
So what is the mission of UPMC for health security?
Well, we're working on health. We're working to protect people's health and to ensure that communities are resilient from things like public health problems like epidemics and disasters. We work on a variety of different issues, and it's evolved over the years. And food security is one of the areas that we've focused on in recent years.
Well, with that food security focus, how does the UMPC research and the consequence of epidemics and disasters, how does that research work?
Well, we are interdisciplinary staff here, so we have a bunch of scientists, a bunch of physicians. My background, as you mentioned, is in public health, and I've actually worked in public health departments. We actually, prior to coming to the center, we also have social scientists, economists, lawyers. So an interdisciplinary group, and we often do our own analyses of issues, and we read the literature, we talk to experts in the field. We also, though, do bring in interdisciplinary outside groups. So if we're studying a complex issue and, we try to find whoever is the most expert in that issue and bring them together, and often try to put them in contact with people in government who are working on issues. So we do our own work. We also bring together groups and foster conversations between government and outside experts.
Well, in that vein, the UPMC has recently published an article, and it's more of a book, then it's entitled When Good Food Goes Bad, Strengthening the U.S. Response to Foodborne Disease Outbreaks. Can you review that publication with us?
Sure. So we've been working on issues around detecting outbreaks and getting better at detecting outbreaks in general. That's an area that we've worked on for a while. And as you mentioned in my bio, I'm also interested in improving methods that we have for doing surveillance for outbreaks and figuring out strategies to stop them once we recognize that they occur. And so looking at foodborne illness was sort of a natural extension of some of that work. And so we started looking into it, and I think our key finding from the report, something that was particularly eye-opening for us, was just how large of a problem this is. We were really startled to learn that each year an estimated 40 million people in the U.S. are sickened by foodborne illnesses. And that, it's not just that they have, an upset stomach and they get better. I mean, significant amounts of people get quite ill. In fact, we learned that more than 120,000 people are hospitalized with foodborne illnesses each year, and 3,000 people die. And we were just really startled by those numbers. It's quite a huge health problem. But we also learned that it's an enormously expensive one as well. Each year, an estimated $77 billion are lost due to medical and lost productivity costs associated with foodborne illness, which is also extraordinary. And then in talking to folks in industry, and I certainly don't have to tell your leadership, I mean, what we're seeing is that the cost of foodborne outbreaks is quite expensive, and actually seems to be getting more expensive each year. I mean, we heard in 2008 about an outbreak of salmonella that was really traced back to a single processor, a peanut processing plant. But the estimated economic tolls of that were extraordinary. I think upwards of $1 billion in lost peanut sales. And just a couple of years ago, there was a listeria outbreak related to cantaloupe, and it was ultimately traced back to a single processor. But we heard about cantaloupe sales in general took a hit as a result of that outbreak, and some estimates were that the sale price of cantaloupes were down by more than 30% while that outbreak was occurring. So extraordinarily toll. And it really, it underscored for us that this is a very important national problem, and really caused us to try to figure out, are there ways of mitigating, reducing the burdens of these events so that we don't have the kinds of health and economic tolls that we're seeing.
Well, I join with you in that. As a matter of fact, preceding those outbreaks was a spinach outbreak in 2006. And my understanding in the entire spinach industry, the number of dollars in that market has never recovered from that 2006 outbreak. In your work in this research, what are the principal lessons that we can translate for our audience of food producers? What can they learn from your study?
Well, I think that the fundamental lesson for us was that the economic toll of these events are extraordinary. But if you compare that to the amount of resources that are being allocated to the problem, there's a huge disconnect. They're really the resources devoted to this problem to prevent foodborne outbreaks and to help us, quickly recover from them when they do occur is a very small amount of resources. And those resources that are being allocated, they're largely being allocated at sort of making the food supply safer, which we think is a worthy goal, of course. We want food that we eat to be safe, and we should certainly continue those efforts to try to make food safer, to reduce contamination that gets put into food. But what we also think is important while we are trying to make the food supply safer is that it's going to be very difficult to secure it entirely, to prevent all forms of contamination. The food supply is extraordinarily complex. Food is being imported from all around the world. So we think in the meantime, while we're working on making the supply safer, we should also work on making better the systems that we have in place for detecting foodborne outbreaks when they do occur, detecting them early, helping us figure out really quickly what's causing them, and then helping us use that information to remove contaminated food from the shelves so people don't eat it, or to issue protective guidance so people don't eat the food, so that we can prevent additional people from getting sick.
Excellent suggestions. In your study, what are the roles of surveillance and rapid response in foodborne pathogen outbreaks?
Well, the most obvious benefit of surveillance and response is that when it works well, we can reduce the health consequences of foodborne outbreak. So this means that we can identify that a foodborne outbreak is starting to occur, identify it quickly when only maybe a handful of people are getting sick, quickly figure out what's causing it, and then, as I said before, issue protective guidance or remove the contaminated food from the supply chain so that additional people don't eat it. Hopefully, if we do that well and do that quickly, we will reduce the number of people who would likely get sick from any given outbreak. I think another important benefit that's probably less obvious is that, and probably underappreciated, is that when surveillance and response work well, we can also reduce the economic tolls of outbreaks. So first, if we can identify early the right source of an outbreak, then we can mount a targeted response that focuses only on those foods that are actually contaminated. And so this will help us avoid situations like you probably remember in 2008 where we had an outbreak of salmonellosis. And in the beginning of the outbreak, actually it wasn't even in the beginning, it was as the outbreak was unfolding, health authorities started to have a sense that perhaps Florida-grown tomatoes were the source of that outbreak. And so there were a lot of guidance issued about avoiding tomatoes, and that stores pulled tomatoes off the shelves, and people were avoiding tomatoes for a while. Well, it turns out, and we actually didn't discover this until the outbreak was largely over, that it wasn't in fact tomatoes that were responsible for the outbreak. Tomatoes were fine. It was actually a different product that was imported, not domestically grown tomatoes. And so, as a result, we missed an opportunity to, focus on the food that was actually making people sick and to tell people what they really shouldn't be eating. But two, the tomato industry took a large hit from that, and really had nothing to do with it. So if we get better at figuring out what is causing an outbreak, we can hopefully reduce the burdens, economic burdens that industries face when they're, one, incorrectly identified as being a cause of an outbreak, and two, if it's only a single producer that's responsible, we can hopefully reduce the damage. If we are able to figure that out quickly, the specific source of an outbreak, then hopefully we'll reduce these sort of industry-wide or product-wide economic tolls that we wind up seeing each time an outbreak occurs.
Well, Jennifer, you've hit on one of my hot buttons, which is my mantra of food producers testing their product in a statistically viable way to assure that before it leaves their facility that it is fit for human consumption. Let's look at one of the conclusions of your study, and that is your observation that the impact of culture-based testing to determine food outbreak causes.
Yeah, right now, this is a very, very important issue. And in fact, when we were doing this study and we were talking to experts from around the country, this was the issue that got everybody really excited. People wanted to talk about this, what they saw as a potential problem on the horizon, this issue of culture-independent testing that's increasingly being used. So right now, our system for detecting foodborne outbreaks that occur across multiple states is entirely dependent on culture-based testing. So our main foodborne disease surveillance system, called PULSENET, relies on having clinical specimens from people who get sick that are suspected of having a foodborne pathogen. What we do is they isolate and culture the organism from the clinical specimens from these patients, and they apply to these cultures a type of genetic analysis called pulsed field gel electrophoresis. And the reason why this technique is used is because it actually provides fairly specific information that helps us determine if, the likelihood that one person, two people, whether or not they became sick, likely from the same source. And PulseNet the system that we have has really revolutionized the way we detect foodborne outbreaks, because it provides such specific information that now, if there are, a handful of people sick in individual states, we can determine that potentially from the same source that a multi-state outbreak is occurring. And that has resulted in earlier detection of outbreaks. That this didn't occur before we had PULSENET. This genetic analysis that we use on these patients is actually also helpful in correctly identifying the source of an outbreak. And so if we have a genetic match between that pathogen that's isolated from a patient and, say, something that's identified from food, then we can say with greater certainty that perhaps this food is what caused the outbreak. And so that helps us, go down the path of a more targeted response than just, the old epidemiologic approach was you interview a bunch of people and you ask them, what did you eat over the last 2 weeks? And you try to look for what food sources they had in common among the list of things that they recall having eaten, and then, whatever floats to the top of the list is what you think might have caused the outbreak, and that's very imprecise and results in a lot of sort of false accusations. But with these genetic techniques that we have, these culture-based techniques, we're getting a lot more specific information to narrow it down. The problem that we're seeing is that there are new tests on the market that doctors are using. And so now if you go into a doctor's office, it's not uncommon, or if you go to a hospital and have a test done, it's becoming increasingly more likely that they are not going to take a clinical specimen and then isolate your organism and then grow it, culture it, which is what PULSENET needs in order to function. There are these rapid tests that just can give you a kind of more general diagnosis. This person is sick with salmonella without culturing the organism. And that's great for medicine because you can get a result really quickly, and it's pretty easy and potentially less expensive to do those tests than trying to grow the salmonella in culture. But that kind of test is completely incompatible with PULSENET. And so people are really worried that as the clinical world starts using these culture-independent diagnostic tests, these rapid tests, more frequently, that the number of clinical specimens that are available for this public health surveillance system, PULSENET, will decline. And in fact, in many places, they are seeing a decline in the number of specimens that are available to them. And some are seeing this as eroding the surveillance system, surveillance and detection system that many have worked so hard to put into place, over the last couple of decades.
Well, Jennifer, that's an amazing analysis, and it really takes us to the area of molecular epidemiology and subspeciation, which can actually exonerate a food producer, because if a patient is diagnosed with X disease generated from a foodborne pathogen, then that subspeciation may actually exonerate them, as we have found as a result of the Townsend Farms recent outbreak of blueberries, when it was a mix of different types of berries, including a pomegranate seed which was produced in North Africa and actually Egypt, and that subspeciation proved that it was not associated with the blueberries. So you're right in the sense that if we can subspeciate those samples, that will exonerate a specific food producer and help localize with a laser beam technology down to the specific subvariety, and even exonerate food producers. Or, unfortunately, it may even indict them in the sense that, yes, we can take swabs from their factory and take a sample from the patient, and if those subspeciation identities match, then there are challenges that relate to food testing. Wouldn't you agree?
Oh, yeah, I completely agree. And I think there's also another potential issue here, which is, not just trying to catch the bad guys, figure out who's the bad producer and who's not. I mean, I think there's industry-wide consequences here in the sense that identifying contaminated food, we've been able to kind of work back and figure out, well, how did the contamination get there in the first place? and then take that information and use it to make sort of positive change in terms of food production practices so that we can reduce the likelihood of contamination in the future. And so that has positive net benefits for industry as a whole. Say, okay, as a result of this foodborne outbreak investigation, we learned that this practice turns out to be a bit riskier than we originally thought, and therefore, new practices are going to be put into place to ensure that contamination doesn't occur again in the future, which just makes the whole industry safer.
That's a very positive outlook. Let's look at the potential positive effect of the Food Safety Modernization Act. That was part of your study as well.
Yeah, FSMA is something that everybody's very excited about. It is the largest piece of legislation, the most comprehensive reform of food safety that we've ever seen. So it has enormous potential in terms of helping to secure the food supply, the making of food supply, reduce the amount of contamination that enters the food supply. People are very excited about it. It also has some provisions, though our analysis suggests that there are many fewer provisions related to strengthening foodborne outbreak and detection. The emphasis of FSMA is really on keeping contamination out of the food supply and less on what we do when some contamination inevitably occurs and then how we recognize and respond to an outbreak. Unfortunately, FSMA doesn't have as much emphasis on that as we'd like to see. But as a whole, I think the legislation is something that is very far-reaching, and people are quite enthusiastic about the potential. I think the worry about FSMA is that it largely has not been funded. And so in the absence of funding, and there have been also delays in terms of its implementation, it's some worry about whether or not the ultimate goals of FSMA will be realized. It's an enormous task that's being asked of everybody, really. And without funding, oversight, and implementation, I guess there are worries about whether or not FSMA will ultimately reach its goals.
Well, Jennifer, I'd like to thank you for your gracious contribution to the AME Food Testing Show today and allow you any concluding remarks. And you also may reference that your report is freely available on the Internet from your website.
Yes, it is available from our website. Our center's web address is www.upmchealthsecurity.org. If you dig around, you can find When Good Food Goes Bad is the title, first part of the title of our report. I can be contacted at the center if anybody has any follow-up questions or interested in learning more. We're enormously grateful to the people that produce food in this country, so we'd like to be helpful in any way, and if we can put folks in contact with any resources that will help them do their jobs, we are happy to do so.
Well, Jennifer, again, thank you for your gracious contribution to the show, and I'd like to allow you any final remarks that you may have in the conclusion of U.S. response to foodborne disease outbreaks.
Thank you very much. I really appreciated being on here, and look forward to hearing the show.
Thank you very much. Have a great day.
You too. Take care.
Bye now.
Bye-bye.